Hi guys, Alan Clark, 2013, in his book, Sociology of Health and Illness Behavior, defined disease as an abstract biological medical conception of pathological abnormalities in people's body. In this last episode, we will be taking a closer look at COVID-19, how countries respond globally. We will be looking at this from the continent of America's perspective. Starting with North America. North America currently have the total number of confirmed cases of 1,635,115 cases. The number of deaths in North America is 99,934, and the total number of recoveries is 408,578. The active cases remain 1,126,603. Number one country on our list of top 4 most heated countries in North America is USA. USA currently have total number of confirmed cases of 1,484,285. The death is 88,507, and the total number of recoveries is 327,751. The United States of America has currently recorded the highest number of confirmed cases of COVID-19 and also the highest number of deaths in the world. As the carnage from COVID-19 in the United States continue to mount at the unthinkable rate of over 2,000 deaths per day, and with unemployment possibly reaching around 32% of its population, and currently about 32 million Americans are applying for benefits. The evidence now demonstrates that without a shadow of doubt, the United States government has failed its citizens in its most fundamental duty, which is protecting it from catastrophic danger. President Trump's poor decision has turned a large-scale public health crisis into an unprecedented health, economic, and security disaster. Trump was warned early and often about the dangers of COVID-19, but all was dismissed, claiming the virus never existed and that it was a hoax.
Do you have a plan to contain the coronavirus in the U.S.?
We do have a plan, and we think it's going to be handled very well. We've already handled it very well. CDC is... Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape, though.
In the name of Jesus, we thank you, oh God, for this group holding up the arm. Yes,
it's all turning. They lost. It's all turning. Think of it. Think of it. And this is their new hoax. And so far, we have lost nobody to coronavirus in the United States. Hysteria mode. At this moment, we have 22 patients in the United States currently that have coronavirus. Unfortunately, one person passed away overnight. Additional cases in the United States are likely.
Is your message that to Americans that it's safe to fly? Can you convince the travelers?
Yeah, I think where these people are flying, it's safe to fly, and large portions of the world are very safe to fly.
Are you concerned that the virus is getting closer to the White House?
No, I'm not concerned at all. No, we've done a great job. My fellow Americans, tonight I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world. Today, the World Health Organization officially announced that this is a global pandemic. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot I also took the test last night, yeah. And I decided I should, based on the press conference yesterday. People were asking, did I take the test? Well, if you don't have to travel, I wouldn't do it. By announcing some important developments in our war against the Chinese virus, we'll be invoking the Defense Production Act.
U.S. introduced travel ban on 31st of January when 381,000 people had already traveled from China to the U.S. in January. In February, passengers also flew into America from Italy and Spain without COVID-19 border control in America. Having failed to contain the spread of COVID-19, the United States was forced to resort to the crudest and most economically damaging pandemic prevention measure, which is to lock down the country. Even then, the Trump administration led from behind, with sports leagues and universities shut down first, followed by governors acting aggressively to bar large gatherings and issue stay-at-home orders. The federal government finally issued non-binding social distancing guidelines on March 16th. The administration did not seek emergency COVID-19 funding until February the 25th. Trump suggests that disinfectants to treat COVID-19 could be an alternative cure. Donald Trump has now finally launched Operation Warp Speed, which has been tasked to provide vaccine for the global pandemic by the end of December 2020. Hopefully, the American government will see a way through this and they put in place a decent strategy to tackle this global pandemic. Next on our list of top 4 most heated countries in North America is Canada. Canada currently have total number of confirmed cases of 75,959. The death is 5,679 and the recoveries is 36,908. The first reported case of COVID-19 was when a 56-year-old man was taken by paramedics to a Toronto hospital in the late afternoon of January the 23rd. Canada has been accused of being too slow to respond to the virus. Until the second week of March, Canadian officials claimed that the risk of the pandemic was low. March 16, Canadian Prime Minister Justin announced borders will be shut on 18th March. The government later issued stay-at-home order, but this was different across the various provinces and it caused confusion. Canada is now preparing for the second wave of the pandemic.
It's tough to even think about the future right now for a company like Inc. Entertainment, which runs bars, restaurants, and music festivals.
Mentally and physically and emotionally, we're completely drained.
Anxiety spilled onto the streets this weekend in Toronto. Residents protesting coronavirus shutdowns.
I kind of just went to bed one night and woke up and I was on a different planet.
Reopening the country is a complicated undertaking, but it doesn't stop Canadians from wondering when it'll happen.
I don't think we should be talking about reopening any parts of the economy if we do not have a strong plan.
Ontario and Quebec are announcing their frameworks for reopening this week.
There's no one who wants the economy open more than I do, but I'm not going to put people at risk.
We really can't afford 2 waves or 3 waves.
This business expert says a nightmare scenario would be loosening restrictions too soon, potentially resulting in multiple waves and a bigger financial burden for the government.
They can't put everybody on their payroll for a year or 2.
New Brunswick hasn't been hit as hard. The province's phased COVID-19 recovery plan started Friday.
With proper physical distancing, people can now enjoy outdoor spaces.
But he also said bigger changes will take time.
The Canadian authority are now currently preparing for the second wave of this global pandemic. Hopefully, the Canadian government will continue to put in place these decent strategies to curb the spread of the global pandemic in the country. Moving on to our next country in North America, the number 3 most heated country is Mexico. Mexico currently have total number of confirmed cases of 45,032. The death is thought to be 4,767 and the recoveries is 30,451. The government of Mexico appears to accept the pandemic will rip through the country and seems ill-equipped to do anything about it. Mexico's public health service is weak. Poverty is endemic. Work for millions is ad hoc and dependent on turning up. People live in slums with no running water. Families are extended and close. There is no regard for social distancing.
Mexico's city is absolutely vast. Unofficially, over 30 million people live here. Its boroughs would be cities in their own right anywhere else in the world. But it's dreadfully poor. People live cheek by jowl. They need work to get cash to eat, and there's little social distancing. It's a lethal COVID-19 mix. Council workers try to encourage people to sanitize their hands on a street corner in Iztapalapa, one of the worst hit areas in the city. They have some success. The point is, this is a lockdown. I couldn't even cross the road. Despite government denials, the medical profession here says the disease is spreading out of control. In some parts of Mexico, people don't think of going to hospital despite being ill. They come to small clinics, and often when it's too late.
Pudiera ser que empiece a la curva a disminuir, pero a lo mejor se va otra vez a disparar, porque no hay conciencia. La gente aquí no tiene conciencia. Incluso mucha gente no cree que exista. Aquí los pacientes que vienen, y yo les digo, probable COVID, no, eso no existe. No, eso es del gobierno.
Less than 20 meters from the clinic's front door, a huge open market is in full swing. People aren't taking the virus seriously, and there's a social stigma to being infected, so people don't admit it anyway. This stall owner says he knows of 20 market traders in this one market who have died. Ignorance and denial are a dangerous mix.
No, mucha gente no lo entiende todavía. Está la gente, hay uno que no cree nada.
Clearly, Mexico still has a long way to go in fighting this global pandemic. Hopefully, the government of Mexico will see the importance of declaring a state of emergency across the entire country so that this global pandemic can be tackled effectively. Number 4 most heated country in North America is Dominican Republic. Dominican Republic currently have total number of confirmed cases of 11,739. The death is 424 and the recoveries is 3,557. On the 2nd of April, following a request from the government of the Dominican Republic, the World Bank released $150 million to support the country's effort to implement emergency measures to contain the spread of COVID-19 and manage the impact of the pandemic on the economy. On March 16, the Dominican Republic declared a state of emergency that will be in place for 25 days and established a curfew for the entire territory. The response model first focused on San Francisco de Macorís, a city in the Dominican Republic, which is Duarte province. The strategy that was put in place by the Dominican Republic government includes increased testing and developing a local business council that helped direct philanthropic efforts. The government strategy addressed issues with local markets, which provided food for families via food bank. The government of Dominican Republic needs to do more. Currently, firefighters are now patrolling every street of the Dominican to maintain social distancing.
Atención, atentos para empezar a mojarlos. Esta es la última advertencia. Ya está. Atención. respete la distancia. Esta es la última advertencia. Ya están listos para empezar a...
Hopefully, the Republic will see a way to put in place a decent infrastructure to tackle this global pandemic. That makes up our list of top 4 most needed countries in North America. Moving on, the next continent on our list is South America. South America currently have the total number of confirmed cases of 403,345. The number of deaths is 21,460, and recoveries is thought to be around 139,719. Number 1 on our list of the most heated country in South America is Brazil. Brazil currently have the total number of confirmed cases of 220,291. The death is 14,962, and the recoveries is thought to be around 84,970. The Brazilian government's chaotic response to the coronavirus pandemic worsened on Friday, 15th of May, as its latest health minister quit barely a month into the job. The president also ignored Covid-19 advice.
Very serious, lethal.
Pelo meu histórico de atleta, caso fosse contaminado pelo vírus, não precisaria me preocupar. Nada sentiria ou seria, quando muito, acometido de uma gripezinha ou resfriadinho.
Porque o efeito colateral do combate ao vírus não pode ser, no meu ponto de vista,
Brazil's death rate is now second only to that of the United States in the continent of America. Brazil's healthcare system has also been hampered by limited testing capability and the shortage of ventilators. Clearly, the Brazilian government has not gotten its strategies right to fight this global pandemic. Number 2 on our list is Peru. Peru currently have total number of confirmed cases of 84,495. The death is 2,392, and recoveries is 27,147. Peru's patchy healthcare system has betrayed many of its citizens. It has a shortage of beds in intensive care units, which has little overflow capacity. Clearly, Peruvian government are currently struggling to combat this global pandemic. Hopefully, the government will review its strategy and put in place a distant action plan to tackle this global pandemic. Next on our list is Chile. Chile currently have the total number of confirmed cases of 39,542. Death is 394, and recoveries is 16,614. Chilean government has received early praise of its handling of the coronavirus crisis and boasts Latin America's highest testing rate for the infection. The country's mortality rate from the disease is low, but frontline staff say public hospitals are unprepared for rising cases. Dr. Claudia, an infectious disease specialist in the capital, Santiago, has warned that it's far too soon to say whether Chile is tackling this global pandemic successfully. Early COVID-19 cases were concentrated in Santiago's rich neighborhoods, imported by wealthy families returning from their summer holidays in Europe. Most of those cases were treated in private hospitals. The Chilean government has now postponed its referendum due to the outbreak of the global pandemic.
This was Chile's capital just 2 weeks ago. For 5 months, no amount of tear gas, rubber bullets, or water cannon could stop ongoing protests. President Sebastián Piñera seemed to have lost control, while the takeover of this war hero statue had become the symbol of revolt against the state.
And this is how the plaza looks now, just...
Hopefully, the Chilean authority will continue to put in place a decent strategy to fight this global pandemic. Number 4 on our list of the most heated countries in South America is Ecuador. Ecuador currently have total number of confirmed cases of 31,467. The death is 2,594 and the recoveries is 3,433. COVID-19 outbreak in Guayaquil, Ecuador's largest city and economic engine, began in February, apparently with infected people returning from Spain. Dead bodies are lying at home.
The images are hard to bear. In Ecuador's port city of Guayaquil, officials have been struggling to keep up with the surging number of deaths. It's a fate no one should have to succumb to. The indignity, bodies abandoned on streets, families pleading for help. As this virus spreads, it's a glimpse of what it could do in the developing world. A nightmare with no end in sight. Everywhere you look, there just aren't enough resources. The morgues are at capacity, so they place bodies inside shipping containers, stacked one on top of the other, as families try to repatriate their loved ones. Marcos Ortega went looking for his grandfather.
Ni siquiera se dignan a entregarle los cuerpos a la persona. Estoy aquí, ya tengo, hoy día mi abuelo ya cumple ya 6 días ya de haber fallecido, estoy aquí día, tarde y noche, duermo aquí, amanezco aquí.
There's no reprieve from a grim fate here. Doctors say there just aren't enough medical supplies to treat these cardboard boxes are being distributed in place of coffins. A special hotline has been set up for those waiting for bodies to be removed from their homes. The line to bury the dead is endless. Others decide not to wait. They dig their own plots. Governments are meant to protect its most vulnerable, and the Ecuadorian government knows it failed. Tell ABC they believe they were able to trace the outbreak back to at least 2 people and places. The first was this soccer game where at least 5 people tested positive. And then there was this woman, Bella Lamila, who we're told had traveled from Madrid, Spain. She died March 13th. But the tracking, like in most of the world, came too little, too late. And there just aren't enough tests here to track all of the country's cases. There won't be accurate numbers to show the breadth this disease has had on the Ecuadorian people. Their only proof? The cadavers on the roads, waiting for a proper burial.
And that brings us to the end of our series on COVID-19, how countries respond globally. Before we round up today, I just want to say many thanks to every one of you that has been sending all sort of topics that we need to look into. In our subsequent videos, we'll be looking at a number of topics. If you have not subscribed to this channel, please kindly do so, as we have so many more episodes coming your way. Thank you so much for watching. Bye for now.